Altaf, Bijarani. I'm from Pakistan and I'm a health procurement and supply chain professional. I'm working with the PR office of the Global Fund Grant under the Ministry of Health in Pakistan, and I'm looking after the supply chain of the TB, malaria, and COVID with the major responsibilities of the drug management, capacity building of the health workforce of the supply chain, and different campaigns dealing of the country in Pakistan of the bednets. So I'm just leading the focal as the focal lead person for these campaigns with the aspects of logistics, planning, of developing the plans for the campaigns, and then the creating the supply chain pools which basically work for the future campaigns. So I'm just dealing all these in Pakistan with the grant of the Global Fund. Global Indaba was like one of the eye opener for me, as this was one of the first interaction for me as at the global forum where I observed that the it was a very big forum where the multiple countries, almost all developing sector representative and from the global world there. So it was a great experience where I learned that the most of the breakout sessions and the detailed discussions were on focusing on the investment in the human resource to get the pool of the human resource, because we have the logisticians, we have the supply chain professional, but the matter is like their the skills. So investment in the skills of the health professional of the supply chain basically are the key factors which can basically result us in the better health outcomes. So this was one of the great experience I learned from there. And Global Indaba was one of the platform where it was emphasized to the private sectors, where it was emphasized to the public sectors and donor agencies on the investments in the health workforce. I mean, they were like the this was a platform where the advocacy was advocacy, how to bring the advocacy for the investment in the health workforce. So it was a very great experience where the number of the participants were there, and we exchanged here common challenges, and we went out to discuss the solutions for when coming back to the countries for improvement over the challenges which we are basically facing in our country. There were a lot of lessons learned from this global Indaba, but translating into practical when we are coming back to the our country, this was one of the challenge, because we have to deal with the political will. We have to deal to convince the senior management. So these there were the certain lesson learned, but as an individual I prioritized few of them so that we can get the better results. One of them was to digitalization of the supply chain for the drug management. This was one of the priority where we were struggling over the years in our country. So through the better advocacy and through the different multiple consultations, meeting and coordination within our organization and within the other stakeholders, we finally got an opportunity to digitalize over one of the disease, that is malaria. And we successfully implemented the supply chain digital module through the DHIS2, where we got the 5,000 health facility data of the supply chain on the monthly basis in our system. So this was one of the you can say one of the achievement which I got which I got learned from the global Indaba and translated practically in my national, and other which I personally observed that the staff are the assets of our country, logistics team and health workforce. So as I earlier mentioned, we have the logistician, but the skills are to be improved. So what we did in Pakistan, we worked with some training programs where we invested in the health workforce to get the resilient supply chain. So we conducted 2 to 3 training programs where we are creating the national pools of the health workforce, so that we can have the better response in case of emergency. So these were the 2 priorities we successfully implemented, but there are other there are other roadmaps we have listed down, and we will be following when we passing with the time. So these were the 2 success which we successfully implemented in at the national level. मैं IAPHL का बहुत शुक्रगुजार हूँ कि उन लोगों ने मुझे एक प्लेटफॉर्म दिया जिसके थ्रू एक मैंने अपॉर्चुनिटी ली कि जी किस तरह अपनी स्किल्स को बढ़ाया जा सकता है। तो मैं अपने जितने भी मुल्क के लॉजिस्टिशियंस हैं उनसे गुजारिश करूँगा कि जी आप इस प्लेटफॉर्म को यूज़ करें, और लिस्टर्स पे और IAPHL के प्लेटफॉर्म पे बहुत अपॉर्चुनिटी आती हैं, जिससे आप अपनी स्किल्स को भी बढ़ा सकते हैं, आप अपने नेटवर्क को भी बढ़ा सकते हैं, और आप अपनी कंट्री के लिए, अपनी ऑर्गेनाइजेशन के लिए बहुत से बेटर आउटकम्स ले सकते हैं। इसके साथ विद दिस आई विल से रियली थैंक यू for providing me this opportunity to give my insight on the global Indaba, and also very thankful to complete team of the IAPHL. So they gave me this opportunity to explore such great platform and work with the national programs and other programs to enhance the skills and better outcomes of the country.